Hello, everybody. Thank you for joining us tonight. We have a special guest with me. I'm so excited. Renata, thank you so much for joining me tonight. I cannot wait to hear what you have for us to educate us on tonight. So for those of you who don't know me, I am Lena Lassiter. I'm the founder and president of Forever Healed. We are a nonprofit. And what we do is we help those who are suffering from a broken heart due to a loss of any kind. We help them to reclaim their lives. We help them to restore. And in some cases, we help them to recover. I have my master's in human services counseling. I'm an advanced grief recovery method specialist. I'm a director in corporate America. And I'm also on the National Bereavement Coalition Board, and I'm an active member on the National Bereavement Coalition for Homicide Survivors Providers. We are also an active partner with the Richmond Police Department Victim Witness Program. And I'm happy to announce, guys, that we just got a contract with the Richmond Police Sheriff Department. So we are going to be a contractor for them, providing grief services to their staff and their residents. So welcome, Renata.
Thank you for having me.
I want you guys to show Renata some love. You know what to do. Send your questions. For those of you who are watching, maybe on a separate page, if you're watching on Renata's page, we may not be able to see your comments. However, we promise you that we will go back and answer every question for you. So show Renata some love, guys. Ask questions tonight, as we always do. Hi, Minister Ross. Thank you for joining us. Hi, Miss Pat. Thank you. Thank you for joining us. And she said, congratulations. Thank you, Miss Pat. Thank you, thank you, thank you. So, Renata, we have been doing this for the last couple of years since COVID. So when COVID hit, we couldn't offer our grief recovery classes because we wanted to be safe. So I was led, to come out here and to just partner with SMEs in the community and other service providers and to just bring awareness, to bring hope, to bring joy, to those who are watching. So thank you so much for being a part of this. Just agreeing. Hey, Kim, agreeing to be a part of this with me tonight. And people are probably asking Renata, like, what in the world? How is grief and hair loss even connected? But before we get there, I just want to just talk a little bit about Renata. So she has been in the industry for 19 years. For 19 years, y'all. So
actually, it's that was old information. I haven't updated the website. So it's actually been 24 years.
Wow. Yeah. So 24 years. All right. So she wanted to follow in her mother's footsteps. So she said that she always wanted to style hair. And she is the co-owner of Silk Hair Studio. So also talking about hair loss and just recognition of Black History Month, Renata, we just want to thank you and congratulate you on being a co-owner of a Black-owned business.
Yes.
So congratulations on that. So again, she's been in the industry, 24 years?
Yes.
And she's also an educator for Brazilian professionals. Now, is it pronounced trichologist? My first time ever hearing that. All right. Yes. So she's a trichologist helping women with hair loss. And as a textured hair specialist, she has performed as a platform artist for Brazilian professionals in Atlanta at the Bronner Brothers Hair Show for the past few years. Now, I'm going to tell y'all her list of certifications, and I just have to put them up here on the screen, okay? Because we could go all night with this. Renata, just congratulations just on all of your accomplishments. Again, just, being a Black business owner, but not just that. I have to say, personally, I have to share, y'all. I was a client of her sister's, for over 20 years before they even were at Silk Hair Studio. And I have to say that, and the only reason why I left was because I just wanted to go natural. And Renata, I don't know if you remember, but even when I was talking about going natural, you kept saying to me, going natural doesn't necessarily mean healthy hair, So even when I was thinking about that, you were still trying to educate me on, it doesn't necessarily mean that going natural, is healthy. But what I loved about Silk Hair Studio and my experience, because I want to say this, it was an experience coming to your shop. It wasn't just a service, it was the experience. So I just want to say thank you and your sister for just a professional experience. It was always drama free. The shop was always clean.
Yes.
You guys respect every client that walked through that door. And you treated all of us uniquely and individually. So I have to say, Renata, I really enjoyed the experience that you guys gave me.
Thank you so much.
For years, people would say, you've been going to the same person for over 20 years. You don't want to try anything different. Why? Why, when they are walking in excellence, would I want to go and do anything different? And it was like a family feel. Yes. So if you're looking for some hairstylists, I'm telling you guys, Silk Hair Studio, we'll get you the address in a minute.
Thank you.
Hi, Chastity. Congratulations to you, Renata, on all of your accomplishments. Thank you.
Thank you, Pat.
She is brilliant. Yes. All right, Silk Hair Studio. So let's just jump in it tonight. Renata, you ready to go?
Let's go.
All right. So people are probably wondering, again, grief and hair loss. So I'm just going to say a couple of words and I'm going to turn it over. So grief has been recognized, you guys, as one of the greatest life stressors that we face as human beings. So this is how it's related, right? So if you add hair loss to the list of struggles you face while grieving, it's probably the last thing that you want to do, or the last thing that you really want to be dealing with. But unfortunately, hair loss can be one of the negative effects grieving has on our body. So when we're going through a psychological type of event or an emotional event, it can have a physical toll on our body, and it can manifest physically in our body, such as hair loss. So the stress of grieving typically leads to increased levels of cortisol. Mm-hmm. And that's the normal hormone that we have to help us to concentrate, you guys, and to help us to deal with stress in our lives. So if we are experiencing hair loss while grieving, know that you're not alone. And that, the hair loss can be alarming sometimes, right? But it's definitely, it's typical, if you are grieving. Now, during grief, though, it's typically temporary. So I do want to say that, and sometimes it will resolve on its own. But I'm going to turn it over now to the professional to talk about this. So Renata, before we get started on the hair loss, can you just talk to us a little bit about your entrepreneurship journey? I know that you wanted to follow in your mother's footsteps, but just talk to us a little bit about that first.
Well, I went to VCU first to get my bachelor's in mass communications from VCU. And at the same time, I was styling hair while going into school. And I stayed in it because it was going well for me. And I was working with my sister, so she trained me. And then my clients, I started to see that their hair was shedding or coming out. My first recollection was a client. She had long, beautiful hair, and she had a alopecia patch. I didn't know that's what it was at the time, but it was like about the size of a quarter in her scalp. And I did not know what that was. And it eventually grew back. And I started to go online to figure out, okay, why is this person's hair this way? Why is that person's hair that way? That particular client, she went to church and they prayed over her hair.
Wow.
Even though she had a head full of hair all the way to her butt, it was that little quarter size really impacted her.
Wow.
And so I went to a hair show and there was this booth and it said trichology. And I'm like, okay, well, what is that? And so when I went to the booth, they educated me on it. And I didn't take their course, but I ended up researching for the right program for me, which was at the International Associates of Trichology and the World Trichological Society in New York. And it was a 2-year program. And you go into the scientific study of the hair and the scalp.
Wow.
And that's not something that they teach you in cosmetology school. It's something that you have to want to learn on your own. And a lot of dermatologists, I was sending my clients to their dermatologists, and they were just coming back with the same regimen, but they all had different issues. And I'm like, why is the dermatologist giving everybody the same thing and it's not working? So that was another important thing. Dermatologists are not trained in hair loss. They're trained in the properties of the scalp. It's up to them as well to go get another level of certification to study about hair loss. And thankfully, now we do have some educated African American dermatologists now that have taken the time to study in Richmond, Virginia, the scientific approach to correcting hair issues. And so once I did that, I was able to come to my clients when they had an issue and say, okay, this looks like this. You may want to go to the dermatologist. I think it's this, just confirm it with your dermatologist. Or I'll say, well, you need to go to the doctor and get a CBC panel done. And like you said earlier, Relina, you have been coming to us for so long. So if something were to go wrong with your hair, if there was any issues that you were having at the time, Kim would know, okay, this is a problem. This is not normal for you. But if you're going from hairstylist to hairstylist to hairstylist, that hairstylist is not going to be able to recognize what is abnormal. So it's important to stick with one hairstylist to determine. And hopefully they're educated enough to say, okay, this is not normal. This is a lot of hair coming out for you. Or I have one client who she actually had a, it's called alopecia areata that comes out in patches, which I was speaking of earlier. And I'm like, you're stressed out. And she is highly involved in a lot of activities. And a couple days later, she ended up having her first seizure.
Wow.
Yeah. And it shows up in your hair first. And the reason why it shows up in your hair first is because the hair is not a primary necessity within your body. So if anything is going on in your body, they take all of their attention away from hair growth and they put it towards wherever the issue is.
Right.
So you'll start to see that shedding in your hair at that point.
Whew, Renata, that's good.
Yeah.
And the fact, like you just said, like sticking with the one stylist, right? Because I have to say, when my hair started coming out in the back, and Kim would always say, your hair is just breaking off in this one spot, and she would always say, I don't, like, what's going on? Are you scratching? Are you stressed out? But you're right. I wouldn't have known if she hadn't shared that with me. So yeah, your stylist can catch a lot of things, especially when it comes to conditions, in our scalp. And I was just appreciative of her, even, because my hair was thick everywhere else, but it was at one spot. But she picked up on it and was like, you have this one spot that I'm kind of concerned about, like, you're losing hair right here, or your hair is not growing, in this spot. So you talked a lot about trichology and going to get certified. So what is a trichologist?
So I spoke on that a little bit earlier, but what a trichologist, what they do is it's a 2-year, well, it's not 2 years, it's really self-paced.
Okay.
But let me try to share my screen for you.
Okay.
Do you have to do something from your side?
Let's see. There we go.
So trichology is the scientific approach to acknowledging and treating and identifying the properties of the hair and the scalp abnormalities. Okay. And what we're going to talk about today is specifically how it relates to grief and to stress. Okay. And we're going to try to condense everything from 2 years of knowledge into 30 minutes. So we're just going to speak on the reasons why someone may have hair loss. It could be something from, you could have one issue going on. You can have maybe 3 different issues going on. You may not be able to narrow it down to just one thing.
Okay.
So in trichology, we call that the 7 H's of hair loss. And the 7 H's of hair loss, we call that hairdressing. We call that heredity. We call that health, healing, hunger, your hormones, which you had spoke of earlier, and hassle. Okay. So we'll dig deep into all of those.
Okay.
Yeah. So hairdressing, of course, when people come to me and they say their hair is shedding, it's breaking, I don't know why. And we have to, especially if it's somebody that came in off the street, I really have to sit down and talk with them. Okay, what are you eating? How do you wear your hair? How have you been wearing your hair for the past 6 months? What has happened in the last 6 months in your life?
Mm.
And that question is very important. They're like, oh, it's normal. Well, then you have to dig even deeper. Well, what do you do for a living? And sometimes these questions are not going to come up just with you asking them. It may come up just in you building a relationship with them and them having conversations, because they may reveal to you that they're going through a divorce, or they may reveal to you that their job is stressful and they had to take anxiety medicine because of the stress of their job. They may reveal to you that they may had to file bankruptcy, or they just lost their home. So they may not reveal those things to you all in the first visit. And once you recognize, okay, you're under a lot of stress. And when like you said, when your client is under a lot of stress, it changes the hormones in the hair. And also you need to find out, okay, how have you been wearing your hair for the past 6 months? And those pictures that I have up there are the scarring alopecia picture is one of my clients. She has came to me like that. And it was from what they call hot cone syndrome, or burning from relaxers. And when you have that, it kind of forms scarring on the scalp, and it's not going to grow back because there's scar tissue there and the follicles are closed. So a lot of Black women do suffer from scarring alopecia, and when it gets to that point, it's not going to grow back. And then you have the other picture on the left is someone that has traction alopecia. And we see that a lot in African American women, and also in Caucasian women as well, that pull their hair in ponytails a lot. Yeah. So just the tension from around the edges will cause that tight braids. You have to go to a person that is not braiding your hair very tight. And that can also cause scarring as well. When you damage the follicle, it may not grow back, or it may start thinning at first, or it may start with slow growth. And when it's doing that, you have to catch it early. That's the key thing in all of these, is you have to catch it early so that you can start the appropriate treatments. Also boiling the hair. And when I mean boiling the hair, I mean when you're shampooing the hair and the hair dry, and when you're blow drying the hair after you shampoo it and it's still wet and dripping, and you go in with the blow dryer and the blow dryer is too hot. You have to get some of that moisture out of the hair. Otherwise, that hot blow dryer is going to go in and boil the hair. Wow. And yeah, so you have to pay attention to the temperature of the blow dryer as well. And of course, flat ironing the hair excessively and bleaching the hair can also cause damage. Flat iron can cause damage to the hair. Bleaching can cause damage to your hair and to your scalp. For those people that have like those short bleach platinum blonde cuts, and they're putting that bleach directly on the scalp, that can also be damaging as well.
And I'm glad you talked about the ponytail piece, because a lot of times, right, it's quick and easy for us, and we kind of pull our hair back and not really understanding the tension that's causing. Somebody have a question, so I didn't want to stop you, but are knotless braids okay for someone with traction alopecia?
Knotless braids are actually okay. They're a good protective style because they don't have the knot right at the root. Okay. And that's where a lot of the braiders, they're trying to pull the hair to capture all of the hair. So when you have knotless, they're a little bit more looser. But the drawback to that is they don't last as long as the box braids, but knotless braids are okay. Okay. But don't keep them in for a long time, and people try to hold on to styles when it's time to let it go.
Yeah, I agree with that. All right. Thank you.
And so the next thing that we're going to talk about is the second age, which is the heredity.
Okay.
And so when a client comes to me, I need to ask them, okay, what about your mother? How is her hair? What about your father? How is his hair? Okay, well, both of their hair is good. Well, what about your grandparents? What about your sisters? So you need to ask those questions, or you need to tell your stylist about your family history, and your stylist can make a proper determination about why, if it's genetic hair loss, because genetic hair loss, sometimes you can't prevent that. But what you can do is you can slow it down, or you can speed it up by the things that you're doing as far as your hairstyles or as far as your diet. You can speed up hereditary hair loss.
Wow.
So you want to make sure you pay attention to the way that your parents are wearing their hair. And yeah, so that's any questions for hair loss with heredity? I didn't see any.
I don't see any.
And then one of the most important things is the health. Your health, not the health of the hair, but your health. Sometimes people have autoimmune disorders that may cause hair loss. And when you have an autoimmune disorder, most likely you're on medication, which may also cause hair loss. Yeah. And so like if you have lupus, or if you have diabetes, those things will cause hair loss. Anemia. If you've had weight loss surgery, that can cause hair loss as well. So you want to pay attention to just if you have like high blood pressure and high cholesterol, all of those things come with medication.
Right.
So it's important to take a accurate look at your health, because it definitely can affect the health of your hair.
Wow.
And it can also disrupt your hair cycle as well.
Okay, we have 2 questions for you, Renata. So they are engaged. Y'all keep it coming. They're loving it. So does sweating cause mold and mildew in your hair? That's one question.
So when you're sweating in your hair, it's actually, we naturally have bacteria on our scalp. And so sweating will feed the bacteria on the scalp, and it likes it. Our scalp, actually, the bacteria also likes oil. So putting a lot of oil on your scalp may not always be good for your scalp either. So I have clients that work out, and if they sweat in their scalp a lot, you just want to make sure that you're shampooing and you're using an antifungal shampoo to get that sweat off of the scalp.
Okay. And then Doris Roberts asks, is male baldness inherited from the mother or father?
It can be both.
Okay.
It's both, because it can come from your mother's side. It can come from her father. It's both.
Okay. All right. Thank you. That's all I see so far.
Okay. And then the next thing that we're going to speak on is, like I said, the medications that may cause hair loss. And like if you're on high blood pressure medicine, if you are on birth control, that will cause hair loss. And sometimes the hair loss will start immediately. And then once your body gets used to it, it will balance out and the hair will grow back. Some medications may cause long-term diffuse thinning all over the scalp. So in that case, you may want to, depending on the issue the reason why you're on medication, if you can fix that issue, whether it be if you're on high blood pressure medicine, can you get your diet straight? Or if you're diabetic and you're on a lot of medication, can you get your diet straight? Yeah. Or if you're on anxiety medication, is there a way that you can relieve some of that stress? Other times it may be an autoimmune disorder, or you're not able to handle the issue and you're going to be on that medication for a long period of time. You may need to talk with your doctor to say, okay, this medicine is causing me hair loss. Is there another option for me? And they may decrease your dosage or maybe try a different brand that may work. One brand may cause hair loss in one person and not the other person. So it's something that you may have to play with your doctor. But once the hair loss starts, you want to bring it to your doctor's attention immediately, because you're not going to know whether, okay, well, I just started the medication. For me personally, when I was taking contraceptive, I noticed that I had thinning in the temple area, and these are hormonal areas. So when you're thinning here, these are like hormonal areas. And I noticed that I had thinning there, and I'm like, well, I'm not going to wait to see if it's going to be long term. I'm going to switch my medication. So immediately when I saw it, I switched my medication to something that had lower hormones in it, and my hair came back.
Because I always wonder why it seems to start like around here, like for most of us. So that's good to know. Okay.
Yeah. And also when you're, if you just had a baby, it'll thin out here as well.
Wow. Okay.
And if you had a baby, normally after you stop breastfeeding, that's when it will start to shed. Yeah.
Interesting.
Yeah. And so hunger goes back to your nutrition. What are you eating? Because we know that your hair is made of proteins. And how do you get those proteins? You get those proteins from the food that you eat. Most of us don't eat what we're supposed to eat. So you want to make sure that, especially if you are a vegetarian, you want to make sure that you're getting enough iron, enough protein in your diet. You may need to supplement, because my clients that are vegetarian, their hair is normally dry and brittle. So you want to make sure that you are compensating for what you're not getting in meat. You may need to take a hair skin for everyone. You may, whether you eat meat or not, you may need to take a hair skin and nail vitamin to supplement for what you're not eating. And severe weight loss surgery. So my clients that have weight loss surgery, of course, their diet is drastically affected.
Right.
And right after they have the surgery, 2 to 3 months right after they had the surgery, that's when their hair drastically comes out, shedding all over.
Wow.
I've had clients that their hair comes back, and I've also had weight loss clients that have their hair has not came back because they're eating the way that they have to according to their diet plan.
Right.
So that's another thing that you have to be cognizant of is your diet. And it's important that we have the right amount of nutrition that was going to provide the energy so that our hair can grow.
Wow. Wow.
Yeah. And your hormones. So when we have an issue and we just can't figure out what it is, why is your hair coming out, I may recommend that you go to the dermatologist, or I may recommend that you go to an endocrinologist or your primary care first, just so that you can do a CBC, just to check your blood, check your ferritin levels, and your hormones, there's so many things that can affect your hormones. It's not just a female issue. Like you said, stress can affect your hormone levels. Your thyroid, if you have a thyroid disorder, that, of course, will affect your hormone levels. If you've had a hysterectomy, that may affect how your hair now grows. Even if you're in your 30s or your 20s and you had to have a hysterectomy, that may affect the amount of hair that you have growing. It may interrupt your growth cycle.
Wow.
Yeah. So even men, if men using anabolic steroids, they may experience hair loss. And then also women that have PCOS, polycystic ovarian syndrome, they will experience hair loss, or they may have hair growth in other areas on their chin and on their chest, and then they start to get hair loss on their scalp as well.
Wow.
Yeah. And which leads me to stress. So the stress can affect your hormones. So when you talk about narrowing it down to grief and how are you even just losing, if you're not stressed out, so you think, you may have normalized your stress and the activities that normally take place in your life. Even so, you will start to experience long-term hair loss.
Wow.
If you're dealing with, say, if you're in an abusive relationship, or if your job is stressful, and it may be temporary stress, but you're in it for a long term.
Right.
So you may have a long-term period of a year, or however long the event is taking place, it's going to affect your hair. I have teachers that when they are in school, soon as school starts, their hair will start to break or start to thin. During the pandemic, when they came back, their hair was healthy.
Wow.
It was healthy. And then when they went back in the classroom, it started breaking again. So you have to pay attention to when, not only what am I doing, what type of products am I using on my hair, but what is going on overall in my life that affects my hair loss.
Right. And Renata, you're right. And sometimes we're just so used to, like, we normalize, right, the stress. But this is just what I do, right? And especially as women, and I'm not negating men, if you're on here, but what I'm saying is, as women, we just tend to just keep going, right? We have this strong woman syndrome, and not realizing that we are so stressed out. So to your point, it ends up being long term because we're in these stressful situations for a long period of time, and it becomes our normalcy.
Right.
Which can be dangerous. We have, let's see, 3 questions for you. The keto diet, my friend lost 100 pounds, but she experienced hair loss also. What can she do to get her hair to grow back? I think we're going to be talking about some treatment options. Aren't we, Renata?
Yes, we will.
Okay. All right. We'll get there, Miss Pat. I promise you. And then Kim said, FYI, people also grieve the permanent loss of hair. Kim, yes, they do. Because if you guys remember, grief is the end of or change in a familiar pattern, right, or behavior. So if you're used to having, long hair or thick hair or whatever it is, and you start losing your hair, well, guess what? That pattern has changed, and people will grieve that. And they don't understand that they're grieving, but you're actually grieving your hair loss. So that's true. Does going through the change affect the hair?
Yes, going through the change falls under the hormonal care category. So yes, I would definitely recommend that you go get your hormone levels checked, and they may recommend some hormone replacement therapy if you choose to go that route. Or you can, there are different hair things that you can do as far as hairstyling to mitigate the loss of hair due to aging.
All right.
Another thing with stress is that you actually see in the salon is called trichotillomania. And what that is hair pulling. And it's an OCD that when they're under stress, that is what they do, is they pull the hair, and pulling the hair and just pulling it out gives them a euphoric sensation.
Yeah.
Just pulling it from the scalp gives them a buzz.
Yeah.
And a lot of times they don't even know that they're doing it because they're doing it subconsciously. And I see that a lot in my younger clients. And sometimes I have to bring it to their attention, like, okay, do you notice that you're pulling your hair now? Or either I have to bring it to their parents' attention that they may be pulling their hair.
Wow.
And even the thing about it is it's so psychological that even if it causes their hair to look not in a good way, they will still pull it. And you can, I have to tell one of my clients, well, do you mind just start pulling in the back? Because she likes to pull in the front. And I'm like, I need something to cover it. So I'm like, okay, just try to pull in the back instead. And even though she wants beautiful hair, she wants to have long hair, but it's a psychological thing where she needs to find other ways to relieve that stress.
Yeah, that's how she's coping, right? Or not, right? Yeah.
Yeah.
Absolutely. Yeah.
And like Kim said, I've had clients that sit in my chair and they cry when I turn them to the mirror if they don't have any hair, if they have alopecia totalis, which means it's an autoimmune disorder where all of your hair is gone. And there's nothing you can do about it because it's autoimmune. And you may have seasons where this year I have hair, next year I don't. The following year, I might have hair again. Then the next year I won't. So it has seasons where it will grow and sometimes it won't. And then eventually it will stay that way. So a lot of people suffer with hair loss more than you think. And the thing is, a lot of clients feel like they're the only one.
Yeah.
And they have to know that they don't have to suffer in silence. There are groups on Facebook that you can go to be a part of a community of people that are losing their hair as well. I've also had clients that they have alopecia totalis, and they know it's not going to grow back. So they're like, you know what? Just cut it off. I'm just going to rock my bald head, and they love it. It's empowering for them.
Yeah.
Yeah. So hair is an accessory. It doesn't make you who you are at all. And if you choose to rock wigs one day, it's fine. But let's talk about some of the treatments to reduce the stress with hair, to reduce the stress that causes hair loss. So exercising. Not only exercising is good to reduce stress, but it's also good for your health of your hair and the health of your body that affects your hair. So everyone needs to exercise at least 30 minutes. Even if you don't do it every day, try to do it 3 times a day just to get your blood moving, just to get your blood flowing. And just speaking positivity into your life, because our tongue has power, our tongue has life. And so just being positive about your outcome is going to relieve some of the stress. And also what I'm practicing now, along with praying, is meditating.
Yeah.
And meditating is something new to me, but it does bring me some optimism, and it does give me some peace. I know sometimes it's hard to find that moment that you can meditate. If you have a family, if you have a husband, and if you have kids, you may need to lock yourself in the bathroom or sit in the car and meditate. But you definitely need to find at least 15 minutes out of the day just so that you can clear your mind, drive to work without the radio on, just so you can just be with your own thoughts. And breath work. Breath work will help. Just if you're about to go into a stressful event, whether it be work or whether it be an event that will cause you anxiety, just breathing and being with yourself and acknowledging where you are in the present moment. Yoga helps with that. I'm not a fan of yoga, but it helps with some other people. I just get discouraged because I'm not flexible, and it discourages me because everyone else seems flexible when I'm not. But with so many, also you want to eat the right foods. Someone had asked the question about eating about the keto diet.
Yeah.
Yeah. So you want to make sure that your you said she lost 100 pounds.
Yes.
On the keto, but your body does need carbs because carbs is energy. And that's how one of the ways that our hair grows. So she may want to do keto temporarily, but you do need a little bit of carbs. And based on her body weight, she may want to find out the appropriate amount of daily carbs that she needs to get for a balanced diet. So keto is fine temporarily, but you do need carbs and to produce good carbs to produce energy in your body, along with protein and iron rich foods and vitamin D and zinc, copper, iron, folic acid, your B vitamins. So that's where all of the multivitamins come in to mitigate a poor diet. And but like you said earlier, whatever the stressful event is, you'll start to see a change in your hair about 2 to 3 months after. Yeah, when it comes to hair loss. Also, you want to make sure that as far as stress, taking a bath for 30 minutes in Epsom salt. That's cleansing for the body. Shutting the door, getting the water as hot as possible, and just sitting in there. That's a moment that you can meditate. Talking to a professional like yourself will also help with just getting some of that out. And I'm sure, do you do in-office sessions?
Not right now, but we do virtual.
Okay. Even if you went to a therapist and you just wanted to just sit in there and just be like, I just need some time just to myself. I don't even want to talk today. Just let me sit here. That's time that you can be with yourself and just get your thoughts together.
That's right. That's right. That's right.
And I'm hearing an echo now, but
it's okay. You sound fine.
Okay. Some oils that you can do when your hair starts to thin, or if you have some areas of traction alopecia, is if you have some inflammation in your scalp, you want to do some aloe vera treatments. You can do peppermint oil, jojoba oil, pumpkin seed oil, and sulfur as well. Also, you can do laser therapy. Laser therapy, it has certain amount of diodes that will help with infrared treatments on your scalp. And you do need to, depending on the amount of diodes that you have on your laser, will determine if you need to do it every day or once a week. So Hair Max Laser Comb is one of the ones that we recommend as trichologists for hair growth. And it also helps with hair growth for those that are going through it with heredity, genetic hair loss. Minoxidil, or also known as Rogaine, but you have to use that sparingly because it can dry the scalp out. Minoxidil is good for those that are going through hair loss for genetic issues. And a lot of people like, well, don't I have to use that every day? Yeah, but you brush your teeth every day as well. So just add it to your daily routine. So it's not a problem with using it every day. And even if you have like a silk press, just put it on a Q-tip and just rub it in your scalp. Your whole head doesn't have to be wet to use this. Just put it on a Q-tip and just rub it in the areas that you need to do it. Saw palmetto is a natural alternative to minoxidil, and that's a pill. And with minoxidil, if you have history of breast cancer, it's not recommended that you use minoxidil. So saw palmetto is an alternative to that.
Okay.
Another therapy that they have is called platelet-rich plasma, or PRP, is where they take your, they draw blood from you and they deposit it into your scalp to promote hair growth. That can be costly. That can run anywhere from $2,000 to $5,000, depending on the amount of the area that you're treating. Then you have a hair transplant. That's for those clients that if they have scarring alopecia and it's not going to grow back. You see a lot of the basketball players with a hair transplant, but you have to have a healthy area of hair in order to transport those follicles to wherever. Mainly, they normally take it from the back and put it in the top. If you didn't want to do any of those therapies, then of course there's always hairstyling therapies. I don't recommend lace wigs, only if you have total hair loss. If you don't have total hair loss and you still have your edges, please stay away from the lace wigs because long-term use of lace wigs are not good for your edges.
That's good to know.
Yeah. And so, but as soon as you notice the issue, you want to act on it fast no matter the reason, you want to act fast as a preventive measure for your hair.
Absolutely. Woo.
Yeah, it's a lot.
It's a lot, but it's good. One thing that you said that just kind of hit me, when you were talking about our hair is an accessory, right? It doesn't define who we are. I mean, that's so true, but we don't look at it that way. I mean, we put so much emphasis on, our hair. So this has been good. And again, it's been 2 years that people have been asking me to do a session on hair loss, but I just wanted to be the right time.
Yeah.
And to make sure we had the right person, come on. And it was definitely you. So thank you so much for just the wealth of knowledge and information. So Regina said great information. And Doris says such great information. It definitely was. So I know that we have gone over time, but I wanted her to get through her presentation because, again, you guys have asked for this. And I wanted to make sure that all of your questions were answered. So do we have any further questions before we let you guys go? So thank you for teaching tonight. I've learned so much. Thank you. Thank you guys for coming on. And we appreciate your engagement. Again, if you are dealing with, hair loss, you're not alone. So Renata, I want you to share, how can those who are watching tonight, or for those who are watching the replay, how can they get in contact with you?
So you can go to our website, mysilkhairstudio.com. You can reach us on Facebook at My Silk Hair Studio and on Instagram at My Silk Hair Studio. And all of our stylists they're not trichologists, but we try to guide our staff in the correct way. If they don't have an answer for you, they call me or they call Kim over to say, what do you think about my client's hair? So you definitely will be in good hands. And if we're not able to take you at that moment, we do have some other stylist recommendations that will care for your hair.
Hey, Adrienne. Oh my gosh, I haven't seen Adrienne in a long time.
I just saw her today.
Again, so thank you for joining. Patricia said great information. Renata, all across the house. Great talk. Thanks, Kim. Thanks, Chastity. Great information, really informative. Thanks, Chloe. And then Tanya said, I'm sorry, I'm late. Taking medication can cause hair loss. Yes. Yes,
Definitely.
Tanya. Did you hear the medications that can cause hair loss? She was talking about high blood pressure, diabetes, things of that nature. So those some medications can cause hair loss. Yes. Birth control. I was listening, Renata. See, I was past it. All right. Thank you all. Thank you all so much. So again, if you know anybody who would benefit from this video, please share with them, because what we're trying to do, again, and I told my pastor just yesterday, it's not about social media, it's about social ministry. So we want to come out here and bring people hope, encourage you, to let you know that you're not alone. Talk to other SMEs in the community to come, and share and educate us. And Renata did a great job. Thanks for joining, Phil. All right, Tanya, she's gonna watch the replay. You have to watch the replay, Tanya. It was good.
Even if you still have questions during the replay, you can. Will they be able to put them in the comment section?
Yeah, you can put them in the comment, and we'll make sure that your questions are answered. So again, thank you guys for being engaged. And again, if you're going through any type of grief, associated with a loss of any kind, reach out to us at foreverheal.com. I'm more than happy to talk with you and to share any information that we have with you. Last thing I want to share, again, we have an ebook, and it's called Understanding Grief. Why did I create this book? Because so many of you ask me questions about what grief is, the types of losses that can cause grief, misinformation. How do you help someone who's grieving, right? How do you help yourself when you're grieving? So you can download a copy of our ebook from our website, foreverheal.com. You can get a workbook that goes with it. And I tell you, it's great information. It talks about the different types of grief, losses, and also will give you some tips on how to handle your grief, as well as to help someone else through their grief journey. Renata, it's been a pleasure having you on. Such great information. And again, thank you and Kim so much for what you do in the community.
Thank you for allowing me to come on your show. And I'm glad to reconnect with you.
Absolutely. Renata, you don't go anywhere. We're going to let everybody else go. Okay. Thank you, guys. Have a peaceful night, peaceful rest to all of you. God bless you. And we'll see you in a couple of weeks. We're going to be talking about colorism. So you don't want to miss that show. All right. So we're going to have Donice Farmer on talking about colorism. So if you've ever been told things like you're cute to be a dark girl, or if you're light skinned and you've been called yellow and red, and that's kind of offensive, we're going to talk about all that and the root of that as well. Okay. So we're going to get healed from that foolishness as well. All right, guys. Have a peaceful rest. Renata, hang on, and we'll see you guys in a couple of weeks. Good night.